What is the interplay between the healthcare system and individuals when considering race and ethnicity? This is the question our group wanted to investigate. We wanted to see what kind of challenges there are, explain why these problems are occurring, and propose solutions to these problems. So what is happening? There is no doubt that there are disparities between races in terms of healthcare quality and quantity. This disparity is even seen when comparing groups of people who are of the same socioeconomic status. Certain diseases have a huge disparity between races. For example, the rate of new AIDS cases in 2003 was 3 times higher among Hispanics and 10 times higher among African Americans than among Caucasian people. These disparities in disease incidence do not only exist in adults, but also with children. African American children have a rate of hospitalization for asthma that is 4 to 5 times higher than the rate of white children. In addition to disease prevalence, insurance is also an issue. Latinos, American natives, African Americans, and Asian and Pacific Islanders are significantly more likely to be uninsured than Caucasians. This is significant because uninsured adults are twice as likely to go without a doctor's visit every year than those who have health insurance. It also appears that minorities receive less care than whites. Black and Hispanic patients were significantly less likely to have received an influenza vaccination and a visit with a mental health care professional. Now that we have identified some of the issues regarding healthcare disparities, we will outline some of the possible causes of these problems. The first major problem is one of a language barrier. One study found that the healthcare use pattern for English-speaking Hispanic patients was not significantly different for white patients. However, Spanish-speaking Hispanic patients were significantly less likely than white patients to have had a physician's visit, mental health visit, or influenza vaccination. Another issue could be the quality of treatment received by racial minorities. One study found that minorities were significantly more likely to report being treated with disrespect or being looked down upon in the patient-provider relationship. 14% of Blacks, 19% of Hispanics, and 20% of Asians perceived being treated with disrespect or being looked down upon, compared to only 9% of whites. Individuals who thought that they would have received better treatment if they were of a different race were significantly less likely to receive optimal chronic disease screening and more likely not to follow the doctor's advice or put off care. Those who reported that they were treated unfairly because of race were less likely to get a routine physical exam, follow a doctor's advice, or receive appropriate secondary preventative care for diabetes, heart disease, and hypertension. Along the same lines, minority populations are less likely to seek out or trust health information from a doctor or other healthcare provider. This pattern places those who are at most at risk for poor health outcomes at an even greater disadvantage. The reasoning for this discrepancy is poor communication between healthcare providers and patients, particularly in regards to Spanish-speaking patients. Now that we have investigated what the problems are and why they occur, what can be done to solve these issues? Interpreter services could solve some of the language barrier issues found in the healthcare system. Another possible solution is the recruitment and retention of minority staff, which would increase the overall friendliness of the clinic and thereby encourage minority patients to participate more actively and gain further accessibility. It would also decrease the probability of racial discrimination occurring within the clinic. One study suggested having training programs that aim to increase cultural awareness, knowledge, and skills, leading to changes in staff behavior and patient-staff interactions. This could help to promote an environment where people would not feel discriminated. Other possible solutions include the use of traditional healers, community health workers, and culturally competent health promotion. Other options include immersion of healthcare professionals into other cultures, and administration and occupational accommodations for minorities. Adopting several of these options would make hospitals more marketable while also alleviating the discrepancies in racial minority healthcare.